Yeah. Welcome everybody. Thank you very much for joining us today for what is our second seminar in a series of seminars that we are hosting around public involvement in research. And today I want to extend a very warm welcome to three speakers who are going to be talking about their experience of running and doing public involvement work during their research. So we have Martha Pusey, who is a doc student, and Chris Maddox, who is one of Martha's public involvement members, and I'll let them do their own introductions in a minute when I hand over to them. And then after their little talk, Jenny's going to run a little talk as well on her experience of doing public involvement from another researcher perspective. So without further ado, I'm going to hand over to Martha.
Thank you, Amy. Thank you. Hi, everybody online, and lovely to see everybody in the room as well. Amy's going to be keeping an eye, I think, on online questions. So anybody online, if you've got questions, please do ask them. We have got time at the end fitted in, but if you ask questions as we go, we'll certainly answer them as well. So we shall make a start. So Chris and I are here to talk about the research study that is part of my postdoc, and very much, as you will see from our very first introduction slide, it was all about having fun. That's what research is all about, isn't it, Chris? Having as much fun as we possibly can. So this is our co-production team as it is. So 3 people living with young onset dementia and 3 care professionals and myself, who I'll introduce myself probably a bit more in a minute, but we're going to get Chris, if you'd like to do your introductions.
That's my knees creak at that.
Stand there. You stand where you like. You can.
I'm just going to read my quick biography because it would be shorter than some of me talking it. Hi everyone, my name is Chris Maddox. I'm a retired police officer. In 2016, at the age of 60, I was diagnosed with early onset vascular dementia. Since then, I've also been diagnosed with Parkinson's disease and Lewy body dementia. Following my diagnosis, I was determined to make a difference. And now I proudly describe myself as a dementia activist. But one step before that, I can remember I had my diagnosis, and within 3 months of my diagnosis, I lost my job because I had dementia. And I now know that we should have found me reasonably just. I had a bit of a mental breakdown. 3 months I couldn't go out of the house, so I was just crying constantly. I remember sitting in my house one day and I thought, you have a choice to make. You can either sit at home and watch daytime television and vegetate, or I could do something with what was left of my life. Thankfully, I chose the latter, and I thought I can do something with what's left of my life. So, the same day, I got on the phone to the Alzheimer's Society, and they sent people around to my house that same day. And I can remember I had hundreds and hundreds of questions going around in my head, but nobody to answer them. So they came and I asked a few questions. And then they said, we're just about to run a course called Living Well with Dementia for people newly diagnosed with dementia. Would you like to attend that? So I said, yes, please. I jumped at it. I think it was once a week for 6 weeks. But I was with other people recently diagnosed. We laughed together, we cried together, we went through everything, including asking powers of attorney, wills, etc. And at the end of that course, I was told, you speak very well. Would you mind telling your story for Alzheimer's Society? And that's how it all started. And the more I gave my story, the more I was asked to speak about it. And I've spoken nationally and internationally now. I'm an ambassador for several dementia charities, including the National Activity Providers Association, also known as NAPA. And I was deeply honoured to be awarded the British Empire Medal in the King's Birthday Honours last year for my advocacy work, particularly supporting people living with Lewy body dementia and those in the LGBTQI communities. I enjoy spending time outdoors and in nature, especially attending a dementia cafe in the woods. Great. I also enjoy visiting my local beach to watch and photograph the sunrise. I don't sleep very well, so sometimes I'm the only person on the beach and I love it. Helping others gives me a strong sense of purpose, and I dedicate time to raising awareness and working with researchers and charities on a range of involvement projects.
Thank you, Chris. Thank you. So I'm Mark Pusey, and I'm a professional doctorate student. So I'm in my second year postgrad, fourth year altogether from a kind of studying perspective. And I've worked in social care for just over 32 years. And
Old enough.
I'm old enough. I very much am old enough. So I started work in social care when I was just 15 years old, and I'll tell you now, best job I've ever had in care. I was a tea girl, and there were 6 ladies who lived in the rest home, and my job literally at the weekend was to sit and have a cup of tea and a chat with each lady. And there was a lady who lived there who every week she had a new photograph and a new story, and that's really what hooked me into care, and really why I'm standing here today, because our research project, and I always refer to it as our research project, it's not just about me and my prof doc, it's about my amazing co-production team. I should say hello to Martin, who I know is online as well. So I've been very well supported by all of my my co-production team, which is really, really lovely. Thank you. So we'll talk to you then a bit about our research. So we've been looking at how to use storytelling to give people with dementia a voice in their future care. And from my perspective, that very much came from working in care, wanting to know always much more about people, but particularly during COVID, when I was attending probably more funerals than I've ever attended in my entire career, probably just in 1 year. But when you went to people's funerals and you would hear stories about people, and I would think, I wish I'd known that. That's a conversation, that could have been a meaningful activity. So I wanted to really understand how can we capture people, their stories, their life histories, everything about them. So that was really the kind of catalyst to the research. We set up a co-production group. So back in, I started sort of January, February of last year. And from a recruitment perspective, I went out to, I think, 6 Alzheimer's Dementia Voices group. I spoke to probably over 100 people with dementia and carers about the research. But interestingly, the recruitment method that worked best for me was LinkedIn. So I think definitely Pete and Martin, very active on LinkedIn. Chris, I know you are active on LinkedIn, but Chris and I had actually met a few years earlier at a conference and stayed in touch. And I phoned up Chris one day and was like, do you fancy joining me on my research? So that's how Chris joined. But very much LinkedIn was really, really helpful when it came to recruiting people with dementia. The care professionals, I went out, I did a talk at the local care association, and from that had people come and said, yeah, I'm interested in being on your co-production team. So we met monthly on Zoom for 2 hours, which started in April of 2026.
This year.
Oh no, 2025.
2025, yeah.
Yeah, that's, yeah, no, 2025. Thanks, Chris. I should have got you to check.
And who's the one with the dementia?
Exactly. Should have got you to check that for me. And we wrote terms of reference that specifically included some ground rules, and everybody contributed to those ground rules. So the meeting being a safe space was probably one of the most important things within the ground rules. And Chris, I don't know if you want to say a bit about why safe spaces are important for you.
Yeah. Do you want me to stand up? Safe spaces are really important for people living with dementia in general, because if you feel safe in an environment that feels safe to you, you'll openly share. If you don't feel that that space is safe, you'll probably climb up and really not share. So that's why the importance of a safe place is so important.
Thanks, Chris. Having microphones on mute was also really important for other members of the group. So if there was lots of background noise, people talking, I know Chris will say people are eating crisps on Zoom, it's really, really difficult to then hear what other people are saying.
I was on one Zoom and people asking me, now I wonder about the popcorn. So first of all, it looked bad. And then we were sitting there crunching it. And with my dementia, it affects me with my sensory issues. So all I could hear was in my ear.
Thank you, Chris. So that's really important. But I think probably one of the most important things, and this was something Chris said to me right at the very beginning before we even started, was to make sure that as a researcher, I'd asked all of the people with dementia, how does your dementia affect you? And then make sure that when we were having our meetings, that we honoured and we respected that. So one of the most important things was enabling people with dementia within the group to talk first. So whether it was if somebody was in the middle of talking and one of the members with dementia put their hands up, virtual or actual, then we would ask that person just to kind of pause where they were or finish where they were to then allow the person with dementia to speak. And that just meant that people weren't forgetting what they wanted to say, which is obviously really important as well. Taking breaks, I think we felt was really, really important. So having a bit of time chatting, discussing what we needed to, having a bit of a tea break was also really important on Zoom, and just having some of that kind of general chit chat that we would have as well. And very much from Pete's perspective, so one of our co-production members runs a comedy club. So if it's not funny, it's not worth going to. So he would always say, can we bring our sense of humours, which is why that was in our ground rules. And using plain English and not academic talk was really, really important for members as well. And not just for people with dementia, but particularly people from who in a care background, and I'd include myself in that as well. Some academic language can be really, really confusing. So we had to make sure that everybody understood what we were talking about.
Can I say a little bit more about
Please do.
When I said about how does your dementia affect you, one of my friends, if she wants to say something, she gets the thought and then it goes very quickly. So she puts her hand up. We all knew on a Zoom meeting, let her speak first, which is what we did. But how, as a researcher, if you don't know that information, you wouldn't let her speak first necessarily. And the other thing, the same friend, she's not able to read anything that is put in the chat box. So if you're assuming that everyone's reading what's in the chat box, some people living with dementia are not able to do that. So this is the reason for the importance of asking a person, how does your dementia affect you? Mm-hmm. And with me, it's not so much my memory, it's the sensory issues. And I'm just going to say something about people speaking too quickly, because if people talk quickly or ask multiple questions, in my head, it just sounds like blah, 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 and I can't make sense of what they're saying. So don't speak too quickly, take a pause, and don't ask multiple questions. You know, you wouldn't say, would you like tea or coffee? Do you take sugar? Do you take milk? Just ask one thing at a time, and that's very important.
Thanks, Chris. Thank you. Okay, so in between our meetings, we used a Padlet board as a way of just kind of communicating with each other, and just, you know, if we shared meeting minutes or particularly I was asking any particular questions, and then people could just literally go in and put their kind of comments within that. And I think one of the great things around the Padlet board was actually owned and managed by one of the members with dementia. So Pete was our IT guy, which was really, really great because I probably would have absolutely no clue about setting it up. So it was great to have Pete just to kind of be there in the background doing all of that management. But I think we all brought our own different skill sets with us. And I think that's one of the really important things with co-production is using everybody's skills, whatever, you know, people's jobs that they've done in the past or, you know, skills from hobbies, using those within research is really, really important. And within our research, we did, everybody had the opportunity to do absolutely anything that they wanted to, or nothing if they didn't want to. So at the top there, top left picture, Chris and I ran one of the World Cafe events to do some data gathering. And we had a great time that day, didn't we, Chris? You
can tell from the
unfortunately, Martin and Pete live a lot further away, so they weren't able to join the kind of World Cafe data gathering sessions, but were very much involved in other ways. So we did some collaborative data analysis. So the picture on the top right there and bottom left. And I think probably one of my real key learning points from the data analysis was when I assumed that I'd told everybody, this is what we're going to look at, this is how, this is how it could look, this is what we might think, that I hadn't actually explained it as clearly as I thought I had. And Chris, maybe you want to say a bit about how then you found that a bit difficult on the day.
Yeah, I was there when we did this bottom left training, and I don't think you can read there's three sections. The top one is magic, the middle one is steps, and the bottom one is foundation. Now, I didn't have a problem with any of the things that were written on the sticky notes, but I did have a problem with knowing which category to put each activity in. So that's where I had to have some help. So I got quite confused, but it was just purely that, not knowing what to put into which category.
Yeah. So for me, as a researcher, that was a really good learning point to be able to acknowledge that if I'm explaining something, I need to make sure that it is clear and that everybody understands, and just getting everyone perhaps to clarify back. And the bottom right-hand picture there, I popped up to Scotland. I say I popped up to Scotland. I did. Had a fly visit up to see Martin. And Martin, as Chris says, Martin has an encyclopedia of a brain when it comes to anything ethics related and anything funding related. So Martin was really helpful in helping us source a funding bid. He knew all the terminology to use, which was really, really helpful because that helped us. But it was great because as a co-produced piece of research, it was about everybody together being involved and doing everything together. I'll always keep saying, it's not my research, it's our research. We've been doing this collectively together. So I'm quickly just going to show you some of our outcomes. So our original idea was that we were going to design a training package for care professionals. And what we soon found as we started looking at the data was that our research question probably wasn't actually our research question, and it began to evolve into what would a facilitator need to do, what sort of training would they need, what sort of skills, competencies, values would they need. So from the previous picture with the kind of post-it notes, this is how we ended up almost envisaging what a storytelling facilitator might need in terms of training and skill sets and values. And we used a kind of hierarchical model in that, thinking about like when you write a job description, you have those kind of essentials within a job, and then you have the more kind of desirable skills, and then you just have that magic quality. And I think within care, that's something I've always talked about staff. I know I've had members of staff in my team who are just magic, they just get it. And actually that started coming out in the data that people were telling us that that's what they saw around some of their staff, that kind of magic and star quality, that perhaps you can't really say there are any particular skills, but you just know that that person gets it. So this is how we decided to kind of set out our kind of competencies then for the facilitator, and a way of people being able to kind of grow and develop. And we've talked a little bit within our co-production group about who was the kind of right person within care. So the right person in care to be a kind of storytelling facilitator. And again, I think we've had quite a lot of debate about that, whether it could be an activity coordinator or whether it's care homes who have kind of front-facing staff who deliver activities out in the community. We haven't really quite got there yet with understanding who is the right person, but we really think we've started to look at what are the best skill sets for people. We then looked at, from the data, so creating some storytelling activities and workshops. And what came out really kind of key was the kind of four themes for the activity session. So those being around people, places, items, and traditions. We were really lucky because we had a couple who joined us at one of our online events from America, who were actually running storytelling workshops in care homes as volunteers. And I was so impressed by everything they were telling me, but they were so impressed that there was someone in the UK doing research around it. They were really excited by that. But they talk so much about the idea of sensory, putting things in people's hands, giving people something to touch, something that's meaningful, and being able to elicit stories from that. So that's something that we really wanted to kind of weave into our storytelling activities and workshops, and that's not just photographs. So quite often when people do work with people around life storytelling, it's using photographs, and photographs as a way of kind of prompting memories. But actually, we were given some great examples. So the couple in America were talking about, they were working with just a group of gentlemen, and they got some hubcaps for them to do some polishing. And there was one gentleman who said, "No, thanks, I was a pharmacist, I don't do manual work, I'm not doing that." And another chap who they said just never spoke, took a hubcap, just was sat polishing, and all of a sudden just started telling a story about when he was in the war. And they were saying, had they sat and said to him, "What did you do when you were younger, when you were in the war?" they wouldn't have got anything from him. Similarly, we heard about
It reminded him of, excuse me, of Bull in his boots when he was in the army, just showing him the hubcap and brought it all back to him.
Yeah, just that motion, wasn't it? Yeah. Similarly, we would had somebody share a story about how they use Google Maps and put people back into the maps. I don't know if you've ever used Google Maps. There's like a little yellow man that you can drop in, and taking a gentleman back to his childhood home, and they were saying the stories that he started telling from that, and even things like cooking as a way of kind of just evoking senses through like peeling apples or the smells. So for us, using the senses was really, really important. And the four themes, the people, places, items and traditions, actually came out of when we were looking at two pieces of specific dementia theory. So the Kitwood flower, which is on the top right of that picture, and the Kitwood dementia equation. So two really key bits of theory within dementia care. So the flower, the Kitwood flower, was theorised that everybody needs to feel loved, but to feel love, everybody needs to feel included, have their identity met, feel attached, have meaningful occupation, and feel comfort. So we took lots of the data and mapped it around the flower, and that is, we soon started to see then how people, places, items, traditions kind of came out of that mapping. We then looked at the dementia equation. So that is where dementia is more than just the neurological impairment and the changes that happen within the brain. It's about needing to understand people's health. So whether they've got, sort of multiple health conditions, how does that interplay with dementia? About their social psychology. So how do they think about life? How do they think about dementia? Even, thinking about planning for the future. How do they feel about that? Understanding people's personalities and people's biographies. So when we mapped all our data kind of across that, we felt that it all fitted together so well, but felt it really needed to be underpinned by the training values, qualities of the storytelling facilitator. So we've kind of we're considering that the model should be revised to kind of include our skill sets, and combining the two models together to what we call that growing compassionate care. Because really, when you've got your staff who can really, they're well trained, they understand dementia, they're really kind of underpinning that support for the person with dementia. All right, anything else you want to say? Good with that? So CQC is the Care Quality Commission. So they regulate all of the care providers. So that actually came out in the data. So I think one of the care providers was saying that in their last CQC inspection, the care inspector had said, "Why haven't you got family trees? This is how we want you to set out our data, or your data for people. Can you set it out like this?" So that's why we mentioned specifically CQC, the Care Quality Commission, within that, because it's something they want to see as a kind of example of good practice within somebody's care plan. I'd caveat by saying that would be that inspector's interpretation and what that inspector would like to see. Another inspector could come along and say, well, I don't mind as long as you know who the family members are. I don't really mind how you see it. That's how CQC inspectors are. They all come with their own preset agendas. You never know who's coming to inspect you. You never really quite know what they're going to pick up on. Yeah. But to be fair, when we were looking at actually if we're going to start capturing some people's stories and data about their lives, setting a family tree is actually quite a simple way of doing it. But yeah, is that all right for answering your question?
No.
Yeah. Okay, so Chris, I've got some questions for you, if that's okay. So we thought it would just be easier to do a kind of question and answer for this, didn't we, Chris?
Yeah.
Where are you comfy? Where do you want to be?
Yeah.
Coming behind the chair. Yeah. First of all, Chris, why is co-production important for you?
I think that when I had my dementia diagnosis, I was 60 years old, and I never said, why me? I just said, why me at this age? Because my father had Alzheimer's, but he was in his 70s. And when I had my diagnosis and lost my job within 3 months, I didn't have any sense of purpose. I'd wake up in the mornings and think, what's the point in getting out of bed? So it certainly gives me a sense of purpose to be involved in something that's meaningful, something that I can make a difference with, because telling my story, people say that hearing stories from people is the best way of learning. And I think that when I give talks, I always say, smile and be kind, because that's what makes a difference. And a person living with dementia may not remember where they went yesterday, who they were with, where they went, or what they did. But they will always remember how you made them feel. And I remember when I heard about research initially, is this the next question?
No, this is your
When I heard about research initially, I thought, well, I never went to university. I'm not an academic, so I can't take part in research. And that was how I thought. And having spoken to other people living with dementia, they thought the same thing, that we're not intelligent enough to take part in research. But I now realise it's the sharing of my life, my stories, and that's the big thing, my experiences. And I think 30 years as a police officer, I saw quite a lot of things, so I think that stood me in good stead as well. Take part in research.
Thank you. And then what does it mean to you to be involved in research?
I think we listen to is one thing. There's so many people, once they know you've got dementia, they don't think you've got anything to say, or they will jump to an end stage of dementia. And I always say there's a beginning, a middle, and an end stage of dementia. I'd like to think I'm still at the beginning. And I was once given a leaflet after I was initially diagnosed with vascular dementia, which said that I had 5 years to live. I was diagnosed 9 years ago. That document no longer exists, thankfully. But I was diagnosed 9 years ago, and I remember thinking initially, what am I going to do with my life for the next 5 years? And I've now lived for 9 years with it, and I'm still at early stage. And I think that doing things, meaning what it means to me to be involved in research, I'm keeping my brain going. And I think that's what keeps me well. I'm using my brain. I'm thinking for myself. And I'm sure that's what keeps me living well with dementia.
Yeah. And I think Martin would echo that as well. I know he's said that a few times, hasn't he? That yeah, it's the research that keeps his brain active, that keeps him going, that's really, really helpful. Yeah.
Yeah,
And then,
I call it catnip to the brain.
sorry, catnip.
Catnip. That's a really good one, Martin. I've not heard that before.
Thank you, Martin. And why is it important that researchers understand how dementia impacts you, Chris?
I think I've mentioned briefly, dementia impacts different people in different ways. You can get a room with 10 people all living with the same type of dementia, and yet how it impacts them can be very different. So don't make assumptions, I think, is really important, because people can make assumptions. If I go to like a medical appointment and I'm with Heather, as soon as they know I've got dementia, they stop talking to me and they start talking to her. And I now stop them and say, excuse me, but you're talking about me. Please talk to me. So, so once you understand, we've spoken at length, haven't we? And I said to Martha, this is how my dementia affects me. And the research understanding how dementia impacts you, I've got to say that Martha is so special to me. And Martha gets it. She gets it. She listens, and she doesn't just listen, she hears what you've got to say. And the number of people that listen, but I don't think they hear what we're saying, Martha does. And she's just so kind. She makes me feel safe as soon as I see her. She's my friend. So, yeah, sorry, I didn't need to blow your trumpet.
I was going to say, make me blush. Don't do it too much, Chris.
But it is so important that you it's like if you have counselling, you have to link in with that person who's your counsellor or who's your researcher, and they've got to show kindness, understanding, that they're listening, because if they don't show those things, you're not going to engage with them.
And not to speak for Pete, 'cause I'm not sure if he's online, but Pete would say, for me, if ever I sent him anything out via email, it needed to be like on a blue background, because that really helped him to be able to see the text to stand out. So, you know, they're the kind of simple things that as a researcher, I probably wouldn't have even thought about. So being able to just understand those little things that I can do to help people just hopefully made it better for everyone else's experience.
I know there's times I've been involved in research and they use so many acronyms, and they don't mean a thing to me. They probably don't mean a thing to a lot of you, but don't use acronyms.
And what do you think is important for researchers to know when working with people with a lived experience?
Transfer experience.
No, I know.
I think what I always say, that I'm still me. I happen to be living with dementia, but I'm still me. I'm the same person today as I was the day before I was diagnosed with dementia. And one of the things I said to Martha, which has stuck with her, is if you look at the word dementia, right in the middle is ME, the word me. So always look at the me in dementia.
Remember, there's always me in the middle of dementia. That's been my one biggest takeaway. Yeah, absolutely. Thank you, Chris. Anything else?
No, just see the person and not the diagnosis. Just see the person and not their sexuality. See the person and not the colour of their skin. So it's seeing us as individual people that have lives exactly like you do. And the fact that I have dementia, I'm still me. And sometimes I felt like standing on the rooftops and shouting, I'm still me, I'm still Chris. And people say to me, you don't look like you've got dementia. What does dementia look like? Should I have it tattooed across my forehead? You know. And then I went to give a talk to a Chinese community. And I thought, I'm not going to say anything that I have dementia until the end of my talk. And at the end of my talk, and I said, do I look like I have dementia? And they were all, no. And they shared so much. And as soon as I said that I had dementia, they said they wouldn't have shared what they shared if they knew I had dementia. I said, but what's the difference? And in the Chinese community, and I'm sure in many other communities, they don't talk about a family member living with dementia because it brings disgrace on the family. And they deal with it in-house, they deal with it within the family. And I know it happens with the Portuguese community and probably many others. And I know that there are some countries where you don't even have a word for dementia. And dementia can be seen as an evil spirit. So there is so much ignorance out there.
Chris? No, you never have to shut up. We'll just move on to our last slide. So just my takeaways really from the whole research process, and my advice, I guess, to anybody who wants to do any co-production research, is just remembering that it's not just about the researcher and their ideas. And I think, as I will always say, it is our study. It's not just my PhD, professional doctorate. It's been our journey together. And that's been really, really important to me. And as Chris was saying, listen to people who have that lived experience and learn from them. And I think even as a care professional of 32 years, I've learned so many things from Chris, from Martin, from Pete. And as Chris said, my favourite takeaway of that. Remember, there's always me in the middle of dementia. That's one thing that I'd never ever thought of before, and it's just so
Can you give an
important.
example of something else that you did? I put you on.
Oh,
No?
no, don't. I'm like, I don't know, it's Chris.
I just think people can link to examples.
Yeah, so I certainly would say I've learned a lot about funding applications, particularly through Martin, and knowing the right terminology to use, and even from an ethics perspective as well. Martin, things that Martin was talking to me about around mental capacity and making sure that we kind of, we're really thinking about, checking that people had capacity to take part. That even as a care professional, I can reel off, the mental capacity, standards, but just those little things that really made me think.
We all need a Martin.
We all need a
And
Martin,
I think that the mistake a lot of people make around mental capacity is that you've got to assume that a person has mental capacity unless you can prove otherwise. And I was in a role recently, and they asked me to take a mental capacity assessment, and I said, why? How the role that I'm doing, how is my mental capacity impacting on what I'm doing? And they said, it's not. So I said, well, why do you want me to take a mental capacity assessment? And just to shut them up, I did it. But, that's all I'd say about that.
I'd say as well, I don't think that stigma is just to kind of, related to some cultures. I think even still in the UK, there is lots of stigma around dementia. So I think I can remember about 20 or 30 years ago, our good friend Subi Banerjee, who is a dementia professor, saying that dementia is always going to be 50 years behind cancer research, and actually we still seem to have such a long way to go. We've done so much around dementia-friendly communities, and yet still we're always lacking behind, which is really frustrating. But thank you for your comment.
Sorry, I missed your name, but in response to what you said, and please don't take this personally, but you said about dementia sufferers. And those of us living with dementia, most of us, I don't like being called a dementia sufferer. I'm Chris and I'm living with dementia. So terminology is so important. And I think that you stand in good stead if you said a person living with dementia, which is what I say. And there are days when I do suffer, but I don't want to be known as a dementia sufferer. So I like to be known as a person living with dementia. And I say I live my life as best as I can with my dementia. So just a little tip for you to take on board, maybe.
Thank you. No, just really finally, because I know Jenny's got some slides to talk through as well. So as Chris was talking about earlier, that kind of building relationships and making sure that they're supportive relationships. And I think coming from a kind of care background, I absolutely get that and get that need to kind of create safe spaces for people, and probably why Chris says that I'm such an easy person to talk to, because that's been my job for so long, just that talking to people, making them feel comfortable and relaxed, and building up that trust, because people need to be able to feel comfortable to be able to share things with you, and then explaining things. So as I was saying about earlier, that my biggest learning curve about making sure that I've really explain things clearly so that everybody understands them. And then finally, just that have fun, which is absolutely, I'd say we've definitely had throughout our entire research journey and experience so far. And we haven't finished just yet, but we've definitely been having fun as we go. And I think we're all done, and I've got any questions, but I don't know if Jenny wants to talk, and then we can take questions afterwards. Just thinking about time.
Yeah, so we're on the time. We've got 15 minutes left of the seminar session. Jenny is happy to record her talk and we can post it online afterwards. But maybe let's just check if there are any questions in the room first, and then we'll see how we go. Maybe Jenny can chip in with answers as well. If there are generic questions about public involvement in research, you can give your perspective. So Jenny.
Sorry, can you go back about 3 slides? Sorry, it's easier to talk to the slide. Next one, that.
Yeah.
I think it's that one. Do you think because obviously the work you've done has very much been around care staff, kind of doing the storytelling side. Do you think family members could do it or do bits of it, even if they weren't trained and so on? Because I'm thinking that trust element, the kind of the knowing the person, kind of features, or one would hope, a bit more with family in the first instance. I just wondered.
Yeah, and I think for lots of family, that's yes, they probably can and they will. I know that particularly there was some of the bits of data where people were saying actually they want to be able to speak for themselves and not have their family member kind of interjecting into the story. We talked a lot about.
I was thinking in terms of doing the
actual activity
rather than the kind of not stepping in for the person with dementia. I didn't mean it like that.
No.
In terms of the activities.
So yes, absolutely. I think when it comes to what are people capturing, does it end up becoming the family version of the story as opposed to the person's version of the story? And Rosemary, who's one of the care professionals on our advisory group, said actually like her daughters only know her from, her, I don't know, 40, I don't want to offend you, Rosemary, 40 years onwards. They don't know her from that sort of in her sort of childhood, 10s, 20s, 30s. So I think we talk quite a lot about people don't know all of your story. And I think even if family members are doing the activities at home, there's a risk that they'll capture their version of their person's story, not the person's story. But yes, I still think there are some family members that can, and also to take into consideration people with dementia have no family, and how do we make sure that we capture their stories? I think originally we thought about doing some kind of testing around the kind of workshops, but kind of drew the line where we were and perhaps see that as the kind of next stages and next steps. Really sort of seeing how the storytelling activity workshops work in practice, getting feedback from the facilitators. There needs to be quite a lot of understanding around who is the right person. Like Jenny was saying, is it family members? Is it care professionals? If it's care professionals, do they have enough time to do it? And they'll always tell you, no, they don't have the right time to do it. Is it more sort of domiciliary providers that are doing home care? Do they have more time to do that? Probably still no, they don't. But I think there's a lot more kind of work to go forward still with this. Yeah.
We've had this discussion about it doesn't just need to involve care homes. And Martha and I have had this discussion
about this earlier, weren't we?
Involved far more. And one thing I'd like to do is get the government to stand up and to speak and to act to some action. I can remember about 4 years ago being at a dementia conference and there was an MP speaking and said, oh, we've got a 5-year plan or a 10-year plan. And my friends stood up and said, I'm living with dementia. I won't be here in 10 years. So what are you going to do now? That would be my question. And the other thing I haven't been my bodies about is why does dementia come under social care when it's damage to my brain? It should come under healthcare. That's another story.
So CQC, I think, would probably, if they can mandate storytelling, and I know that they're just about to launch or have just launched their new quality of life tool for when they go and assess learning disability provisions. And within that, they actually talk about the use of storytelling. Now, if that can be rolled out into older people's care, absolutely fantastic, because then, care homes are going to have to start looking at how they can do storytelling more widely. I think if you can start local with local governments, absolutely fantastic, because then it starts to grow more traction and then kind of gets fed up, sort of up to higher government as well. Rosemary in West Sussex is very key at kind of pulling in all the MPs, and I know she was talking to one of our Horsham MPs recently, and she was talking to them about, the importance of people's stories and people's lives. So I think the more we keep telling people and the more we keep raising the profile of dementia and what needs to be right for people, hopefully somebody in government will listen at some point. So from a numbers perspective, I probably wouldn't say there is a specific number. I think we looked at it more in terms of kind of diversity. So diversity in terms of types of dementia, geographical location. So I mean, we probably couldn't get a more further spread out co-production group. Martin's up in Scotland, Pete's in the Midlands, Chris is over in East Sussex. All the care providers are all in West Sussex, so we're really spread out. Even from a kind of demographic perspective, so people who are in those kind of more rural communities. So I wouldn't say, I don't know, what would I say a number? 6 seemed like quite a nice number. It seemed manageable. More would probably just start to get a bit chaotic.
I think from a person living with dementia perspective, we always say a maximum of 10 people, because otherwise, 10 is quite a lot anyway. If you've got 10 people wanting to speak, it's giving everyone that opportunity to get their point across. And the more people that you have, the more confusing it can get and the more busy it can get. So if it's people living with dementia, I would say no more than 10. But 6 to 8 is good.
Yeah. And so you asked about kind of how do you kind of get people to get to know each other. So our very first meeting, we actually shared our own sort of mini biographies with each other, and we just spent that first meeting just getting to know each other, really. I'd had the privilege of, being able to talk to everybody beforehand. So, I knew loads about people, and people probably knew a bit about me, but we spent that first meeting really just kind of getting to know each other. I think it probably helped as well that, like, Pete and Chris and Martin have all worked on different studies together as well, so they did know each other. But obviously,
Did you ask us to bring items and talk about the items? Was that you?
no, that wasn't me. No. Oh, somebody else.
Another good icebreaker is to bring an item and talk about it that goes back to your childhood or your memory. And I'm Welsh, and I lived in Wales until 2017, and my one grandfather was a coal miner, and I have a coal miner made out of a piece of coal. So if I'm asked to speak, I take that along, because that goes right back as far as I can remember. And they're good things to talk about. It gives people a little bit of your background as well. So that's always a good starting point, or something that's important to you.
So we had some other questions in there, and I think I literally remember the first and the last, not the ones that came in the middle.
It's very difficult.
I've got one top tip. If you're working with people living with dementia or whatever you're working with, get them involved right at the beginning, not halfway through, not towards the end. Get them involved right at the beginning, isn't it?
Yeah, that's fine. So a facilitator, yes, I guess, but is it not about kind of upskilling and training the staff, the researchers that you've got, helping them to understand if they're working with people with dementia or other conditions, kind of upskilling them around that. The stuff around kind of personability, well, that goes back to that thing around the magic quality. People have it, they don't have it, but everybody's got that ability to kind of empathise. So maybe it's some kind of training around, the sort of active listening, getting them to do a bit of kind of just general chatting almost. I don't know, just in that kind of group context to kind of hear people's stories and kind of reflect on it. So maybe some kind of reflective practice as well could be really, really beneficial.
I worked as a facilitator, even though I've been living with dementia, because I can put things across well. And I was doing something for the Alzheimer's Society fairly recently, and we won an award for what we did. And it was a training session for other people newly diagnosed. And there was 3 people with not much experience, and I had quite a bit of experience. So they used me as the facilitator to speak to the other people living with dementia and the caregivers. And they felt they could speak easily to me because I also was living with dementia. So you can use people, if you've got somebody that stands out in your group, you could use that person as a facilitator maybe. I'll do it for you.
So I'm just going to quickly answer the other part of the question, which is around how do you kind of get to care homes. I think you just have to keep banging on the door, would be my kind of honest opinion about that. Go to like care association meetings, if you can do presentations there, but keep going back, I would say, is the answer. Don't just assume that because they've heard it once, they're going to go, yes, great. because they're so time poor, they're going to go, yes, great, and get back to their office and go, oh, I'll do that next week, and then forget. So I just say, keep going back and keep just being in their faces. Even say, you know, can I come and have a look around your care home? Can you, you know, because actually care home managers love showing people around their care homes. And the other really good tip is to tell them how important evidence-based practice is when it comes to CQC. That's always a winner. Always a winner.
With the care home 2 years ago, Heather and I and two other couples were asked to go and do an audit of a brand new care home that hadn't been opened, to have a look around, see what we thought and feedback. And we did that, and we said about quite a few things, and they took it all on board and changed it. And that's little things like, rather than just having a white toilet seat, get a coloured toilet seat so the person can see where the toilet is, and not having really busy carpets. We're staying in the Ibis Hotel here. Honestly, the carpets are absolutely just little things. And living with dementia, we've done an audit of our local train station to see what things are good and what things aren't good. And they will take that on board. So it's surprising if you keep knocking the door. And we've only been asked to do that once in order to the care home that before it had opened. But they were saying how beneficial that was, that they had people living with dementia to go there and do that before.
I think it was just the checking back in afterwards that I think that became like my new, I've said this, what did you get from me? What did you hear me say? I think that's the
What did you hear me say?
I just said, I don't understand what I want to do. And so we talked it through there and then.
Yeah.
Which gave me a better understanding of what was expected of the category.
Which also made Pete and Martin kind of go, oh, hang on a second, you think that, I think this. And it was like,
We did.
oh.
Yeah.
Yeah.
I apologise for the alarm, it reminded me. Sorry.
It was a good alarm actually, because it's 2 o'clock. We actually used up the hour. Can we all just say thank you very much to Martha and Chris for sharing? And it feels like we could stay here for a good other hour, carrying on talking with lots of questions. We obviously planned to pack in too much. I'm really sorry, Jenny, that but it felt right to let Martha and Chris continue. But Jenny also has a wealth of experience of doing public involvement work, and we'll see maybe if we could get some of that shared up on the Inspire Portsmouth website that we have. So if for people who are savvy with their phones, there's a QR code there that takes you to the Inspire Portsmouth website, which is all about helping grow public involvement in research. And we have a series of events happening as part of that. And our next seminar is going to be talking about ethics in public involvement and what sort of ethical considerations should we be considering when undertaking public involvement work. So a very important topic. And yeah, so I hope to see you all there. We start to say thank you again.
Thank you, everybody for coming, and thank you to everybody online for coming.